So today I'm going to be treating carpal tunnel with the Endolaser 120. I'm going to come into clinical protocols here, go down to carpal tunnel, and you'll see once we get into the settings, it's obvious I'm using the cluster probe because there are 4 points pre-selected. The cluster probe has 4 laser diodes at 800 nanometer wavelength within it, and so it's a minimum of 4 points. If you were treating a smaller wrist or an individual tendon, you might choose to use the single point laser, in which case that will just say 1 point. Each of the laser diodes does a centimetre squared. We're going to be giving 4 joules per centimetre squared, and that means we're going to be giving 16 joules overall. The treatment is set for 20 seconds at 200 milliwatts. It wouldn't be unusual to turn this down to 100 milliwatts. All that would do is double the treatment time to 40 seconds. I'm not going to do that today. I'm going to be treating my own wrist. The reason I've chosen the cluster is because I have a larger wrist, and we'll come back once I get to the treatment. To treat the carpal tunnel, I'm going to bring the cluster probe over the area that's affected. You can see here I might be better doing 2 spots rather than 1. I actually find 1 is effective enough for me, but this is a large enough area that it might take 2 spots. So that would be 2 spots of 4 points. Come into the middle here, turn on the laser. If I was using the single probe, obviously I'd need to do more spots because it's a single point per spot. With the cluster probe, I can do 4 centimeters squared quite quickly. You see the treatment time passes very quickly, and I find that enough to keep my carpal tunnel under control. Okay, seen from the view of the machine, when you start the treatment, you'll notice that it starts to count down and the joules start to count up. So you see here the applied joules going up until it gets to 16 and the time going down until we get to 0. Generally, to reduce the inflammation and the pain in and around the wrist, that's the end of the treatment session. I'd recommend doing this treatment for myself usually 2 or 3 times until the pain goes down. As I treat patients myself day to day, often that will reoccur and I'll just treat myself again to bring it down. I usually do 2 or 3 sessions subsequent days, so day 1, day 2, day 3. You don't have to do that. You can leave longer periods in between the treatment sessions. You'll still get the same results. It'll just take a little bit longer. I don't personally use the laser with any other treatment, so I don't do any other exercises, although I do exercise regularly with weights, which again in and of itself adds to the inflammation within the carpal tunnel. I do have a stronger grip, obviously, because I treat patients and because I use weights, so I don't really feel the need to do more resistance exercises. I don't do any flexibility exercises. The laser is generally enough to take down the inflammation and the pain until I need it doing again.